Hello everyone. Myself, Dr. Neetu Modgil. Welcome to my channel, Dr. Neetu Modgil ENT. Today we are privileged to have Dr. Chiossone from University of Miami, Florida, and he's one of the famous cochlear implant surgeons in the world. Dr. Chiossone, it's a kind of pleasure, and we are really glad that you're here to spread the awareness for cochlear implant. And I am really happy to give you an introduction, but we would really love to hear from you. And please, may I have a prayer to have your introduction on my channel, please?
Yes, thank you, Neetu. Thank you, and thank you so much to invite me to your channel and to invite me to do this a very important activity to teach people or to give some information to people that really needs. I think you're doing a marvelous job there, and I always encourage about the young generations heading and stepping forward in this magical world of the cochlear implant. And I always call it a magical world because essentially it's the best part of medicine, which is the part of giving. And I would say it's the most rewarding experience in my last almost 27 years of practice and as a neurologist.
Right. Thank you, Chizon. If I would like to introduce once that Chizon has done more than 1,200 cochlear implants and he has a rich experience with cochlear implant, and definitely we are going to get the answers with practical experience he has. So, Dr. Chizon, first we would like to view the scenario or the development milestone of the speech. What is the alarming time that they should go and take expert advice that this is the time the speech development has not happened, so they should go and seek the advice for that?
Yeah, the always the intention is that the earliest the better. So once we can teach parents to see what is the auditory behavior of the kid, of the baby, that's very, very important. That means even with the early stages in life, even with the baby is very early in time, days, even weeks, even very early months in life, you need to look at what is the response towards sound stimuli. Sound, if you know, if the baby likes when mom sings, if the baby shows in their eyes or gestures some responses to sound, that's very important. That's very in very early stages. That doesn't disqualify that always, and is in the best scenario, kids needs to be seen by the pediatrician. So pediatrician usually see, or the primary care doctor will see if there's anything wrong or if there's anything really that it's easy to see. On the more, I would say, stage, or I don't know how much is the availability. There's not the same availability everywhere in the planet, but obviously hearing test, we can test kids very, very early on,
Right.
hours after birth. So
Right.
if we can test, if you can test the hearing very early in time, you're actually saving a lot of time. If the kid doesn't pass this test, then we can start looking at more carefully in the early month of this baby, and then repeat several tests that can give you more accurate levels of hearing on that kid. And the most important thing is intervention. Intervention means whatever we're going to do to the kid to provide their better hearing for the purpose is speech development. The earliest, the better. The earliest we go on that direction is the better. So there are three different stages. One, the one you do at home, and they need really, if you have a baby with a very little response to sound,
Right.
at age 10 months, 12 months, that's critical. Because
Okay.
if we can't do the diagnosis, even I would put the barrier at 12 months. Everything that we're going to do afterwards is going to be very useful for a kid. It's going to be very good for the rest of the life of the kid. If we wait until 2 years old, that's a little bit late. It's not perfect. It's still good time, but not perfect. We can't delay that to 5 years old because that would be very late.
Right. So, Dr. Chizon, so I will summarize it for my public. Like he's saying that we have to recognize if there is a problem with the hearing very early, means within first week the baby is born, or at max within 1 month of the baby is born. And we need to take the intervention if by chance in 1 month after the baby is born, we are finding some trouble with the hearing. We need to take the intervention either with the hearing aid or any other surgery like cochlear implant. It has to be done within the 12 months of the age. And even if it is crossing 12 months and the baby is 2 years, it is called delayed. So it is a kind of semi-emergency situation, which I have been explaining to my patients that it is a semi-emergency. So thank you, Dr. Chizon. Now, for cochlear implant, what are the right candidates? Like how much hearing loss they should have, a 1 year hearing loss, both ear hearing loss, or amount of hearing loss they should have. So what is the right candidature you can explain for the cochlear implant?
Yeah, the indication, the formal indication for cochlear implant has changed. I remember 20 years, more than 20 years ago. Now I have to say 30 years ago when we started our cochlear implant program. Uh, the the rules were different. We were just starting implanting kids. Kids implantation came in the 1990, and we started our cochlear implant program in 1992 in Venezuela. So there was kind of a big jump, and from there we have changed a lot of what is the criteria for cochlear implant. But the main big criteria that hasn't changed is any hearing loss that has no or limited benefit for amplification with the hearing aid. So
Okay.
the first big one, if you want to put something in a big one, which hasn't changed, is that very simple one. People can understand. If you're not doing well with a hearing aid, if there's no benefit from a hearing aid, obviously the alternative, the next available alternative, is a cochlear implant. Now, from there, there have been some differences, some new indications, such as if you have limited but still useful hearing for a hearing aid in 1 year and no hearing in the other ear, that could be also an indication, because cochlear implant will benefit the patient in a way that the hearing aid that is using in the other side will also complement the results of a cochlear implant. So that's another thing. So maybe 1 year is not good for a cochlear implant, but the other is, then you consider cochlear implant on that bad hearing ear. The other thing is considering a implantation on patients with single side deafness. Just 1 ear, very good ear, the other ear is completely dead or very, very, very extremely limited. And in kids, that's a difficult call. That there is a trend to do that. If a kid loses his hearing, like because they have a parotiditis or they have a viral infection and they lose the hearing in 1 year, seems to be that the benefit is if you do it quite quickly. So if you
Okay.
do it quite quickly, the kids will benefit from that. In adults, it's a different story because the time frame in adults is much bigger. So
Right.
you can, but it has to be very individualized. You need to really sit with the patient, sit with her, which are the expectations, and might be that's a possibility. That might be the solution for the patient. Now, not every patient qualify for that, and that's why it has to be individualized. They need to go to the ENT, they need to go to the doctor, they need to get all the tests done and see if that's a possibility to do that cochlear implant. So,
Right.
in the main thing, I mean, I would say, no benefit for hearing aids, go to cochlear implant. Limited benefit from a hearing aid might be a candidate. Okay.
Right. Right. Thank you. Thank you for summarizing it. So, Dr. Chizon, now patient has been qualified for the cochlear implant surgery. Now, our next question, which arises from patients usually, is how much time does it take usually for the cochlear implant, and for how much time they are supposed to be hospitalized after the surgery?
Well, that's a great question. I've been uh, doing cochlear implants and been in many places around the world, and there are differences. And the difference, incredibly enough, there are more difference because the system
Right.
put those difference rather than medically what's really needed. Cochlear implant surgery is an ear surgery. It's a mastoid ear surgery, so it's no different than any other mastoid ear surgery.
Right.
What it means is that most of these patients can be done ambulatory. What it means is they go in the hospital. That's what we do here, and that's what we did in Venezuela. They go early in the morning in the hospital. They get the surgery. They have the recovery time for 3 hours, and they go back home.
Oh,
Because
wow.
essentially, you don't need to keep them in the hospital because you're not gonna give them any medication unless there is a complication, unless the patient is very dizzy, but
Right.
that's very little. That's less than 2% of the patients. So out of 100, maybe you will need to have the patient admitted with a medical condition just in two patients. Now,
Right.
the surgery can be depends on the ability of the surgical team. It can be from 3 hours. I wouldn't recommend a standard CI surgery that lasted more than 3 hours because there are some infections issues.
Right.
But you have you know surgeons or teams that can do a cochlear implant in 45 minutes, 30 minutes, 45 minutes, and
60 hours. I have seen one day. I have seen that case too.
then yeah, we usually when we do campaigns we were doing campaigns in Mexico, we were able to do 8 cochlear implants in 2 rooms in the same day. We do 40 cochlear implants in a week, and
Okay.
that means that we do 2 in the morning, 2 in the afternoon, and that's. But remember, it's not a matter of the speed; it's a matter of how the team works. So for me, average time runs between 45 minutes to an hour, and I think that's the safe time, and is an ambulatory. Very little pain. What the
Right.
two most discomfort thing that the patient with the cochlear implant will have, eventually they can be dizzy. So especially in kids, you need to be careful, mom. The first 72 hours, don't let the kid run around.
Right.
Don't let the kid stay in bed. It doesn't have to stay in bed, but you don't want that kid to just go and play around like crazy and running because the kid could fall, can get dizzy and can fall. So
Right.
my recommendation is after 72 hours, if the kid hasn't been dizzy, just let it go because it's very unpainful.
Perfect. Perfect. So, what is the success rate for cochlear implant? And like this is maybe a random question, but it does come from the patients very frequently. That what is the success rate?
It is unbelievable because it's so difficult. It's absolutely so difficult to put just a number. And
Right.
a number. People like the big number. How great is this? How successful is this?
Yeah.
Now, let me put it. I'm gonna put first an example
Hmm.
and and give you because success depends on so many factors. What we know from cochlear implant, if the indication is correct, if
Hmm.
we are implanting the right patient,
Hmm.
patient first will hear, and
Right.
second, they will have a tool to rehabilitate themselves and to develop language. And
Right. Right.
in a very, if the patient is well selected, that's that that number is very high. And we're talking about more than 80, 90% people
Perfect.
rehabilitate correctly. Now, which is the level? How they gonna go? Their kids are gonna be better, much better. Their kids are gonna be average. They're gonna be kids that they're going to be less effective. Now, this is like a classroom. When you go to a classroom and you put kids in a classroom, you're gonna have the A plus kids, the small numbers of A plus kids. Then you're gonna get the huge number of kids which are average, and then you have the very small number again of kids with problems. Cochlear implants behave the same way. And I remember that in my waiting room, moms talking about their kids. Oh, your kids do this, do kids, my kid do that, start to compare.
Right.
It's the same talk if you put the same moms in a classroom. Your kids is A, my kids is B, my kids is C. It's sort of the same thing. So I want to encourage um, parents. This is a tool. This is
Right.
an incredible technological tool that we can give to a kid or a patient with hearing impairment.
Right. Right.
So what you're doing is putting the tool, giving the tool. From there, depends on the kid, on the rehab, on the schooling system, many things. So it's multifactorial. So what the cochlear implant is not the saving tool that's going to save the life of the person. No, it's not. It's
Right.
just a tool to improve the quality of life, to improve communication, and to put this kid in the same level as other hearing kids.
Perfect. So, Dr. Chizon, you have already covered partially my next question, which I would like to ask that what is the importance of speech therapy after cochlear implant? Because the cochlear implant surgeon, when they do a surgery, it's just like they have given a keys for the car. Now you should know how to drive the car. So driving the car is in the hands of parents and the kid and the rehab team. The surgeon's work is just providing the key for the car. So, Dr. Chizon, how much is the importance of speech therapy? For how long they have to go for the speech therapy and rehab? Uh, can you please just highlight?
It's extremely important. So this is part that the two very important separate things that we need to. First, we need to know that the implant will continue and it will be working nonstop, and that's very important. That it's well fitted and it's well serviced. And the second thing is that speech therapy is very important. Speech therapy becomes a key issue. You need to give the kid the reference of what is going to be the things that they're going to do to make the most of the cochlear implant. So that's what essentially rehab is doing. There is one thing which I always have been recommended, and in our side we were very successful, is that when you have a patient which is candidate for a cochlear implant, even if they have very limited, very extremely limited benefit from a hearing aid, or no benefit from a hearing aid, even if they're not using a hearing aid, speech therapy is very important, even before the cochlear implantation. And let me tell you what is the philosophy of doing that. Once you start doing that before the surgery, and the kid goes into surgery, which is a big step for them. You know, something happens. They sometimes they don't know what is going on, but they go back to the therapy. You're not adding two new things. You're not adding the surgery and the device and wearing something, and then another new thing, which is the therapy. I would always recommend to start before the surgery. So if
Okay.
you start before the surgery, the kids will go back to their normal therapy sessions now with the cochlear implant. So it will be less of the impact for the kid. So I
Right.
would highly recommend that. I mean, if you're really onto the low cochlear implant and you are kind of 6 months away from the surgery or whatever time you're away from the surgery, just consider to start the therapy before. So that's it's not going to be a huge change for the kid.
Right. That's great. So basically, make them acquainted with the process and acclimatize in the new environment before the surgery will be good. Perfect. So, can a patient go for MRI and do swimming after the cochlear implant?
Yes, and there's big changes in that.
Right.
Cochlear implants at the beginning and the first generation of cochlear implants and some cochlear implants, probably before essentially 2015, most of them were not theoretically MRI compatible.
Right.
The compatibility became to like very low power MRI scans that you can do it by wrapping the head of the patient with it and then putting and going to this low kind of low power MRI scan. The problem with the low power MRI scans are not very accurate of
Right.
many things that you want to make a diagnosis. The other thing is that the other way was to remove the magnet, but that means that you have to go to minor surgery. Sometimes patient needs to get sedated, take the magnet out, and then do the MRI. The MRI also will be affected by what we call the metallic shadow of the implant on the
Right.
MRI. Now, the companies right now have developed I think all of the companies already have developed magnets that are fully compatible with the MRI scan, and they diminish the magnetic shadow.
Okay.
And what it means is that the new generation of cochlear implants, they're MRI compatible. So that's the big question. And I have had patients now which they need to have repetitive MRI scans, and they had a previous versions which they have been using for 15 years, and they have been now changed to new devices just for the MRI. So we are replacing functional cochlear implants for MRI compatible implants. That was at the beginning for me it was difficult because I really hesitate to remove a cochlear implant that is working. But so far, the results we're seeing and the benefit is that the cochlear implant we put 15 years, 15, 20 years ago, the electrodes were different, were bigger and different. The new electrodes we're putting now are much smaller and less traumatic. So it seems to be that the results with these new cochlear implants are very good. Even patients that are really thinking, wow, this is better than whatever I had before. Swimming, yes, there are two scenarios where you swim with a cochlear implant. One is without your processor. Once you take off the processor, you are not hearing, patient is not hearing, but it can swim and they can, do swimming with no problem. Uh, with the new devices, there are some of them which are waterproof. All of them have kind of a waterproof casing that they can wear when they're swimming and patient benefit. Now, there's a very interesting paper that was done in audiology in one of the audiology journals, and they say that even patients own those packages. They rarely use it. So they use it essentially if they're going to do kayaking or they're going to do something that they think that they need to hear, but for just swimming, they usually don't wear it. But if they know that they're going to get wet or they're going to do trekking and it's going to rain or something, they use this waterproof package that the cochlear implant companies offer.
Perfect, perfect. So, Dr. Chizon, before a certain number of years, the cochlear implants had some life that after 15 years or maybe after 25 years, they have to go for the reimplantation with new implants. But now with the advanced stages, we are having the new implants having more life like 80 years, 75 years. Would you like to highlight this particular thing?
Yeah, the CI lifespan is it's it's a big question mark because theoretically there any new generation of cochlear implants they offer a warranty usually for 10 years for the internals, but we know for sure that they lasted much more than that. I mean, uh, I have patients that were implanted in the early 1990s with a device that is still working. The problems are some limitations on technology, that they have a cap. Newer implants that were implanted during the late 1990s, but the early 2000s and mid 2000s, those patients are upgrading in a very great manner because those implants were designed way much more compliant to future technology. So I believe that uh, we will see more change. We're not seeing really replacement due to a difference in technology on those generation, but more on the, as I mentioned, on the MRI issue might be, or maybe the rate of failure. That a cochlear implant could fail anytime. We did a work to see when it was the most likely time that a cochlear implant, a long-standing cochlear implant will fail. And essentially, what we saw is once the cochlear implant reached about the 10-year mark, it would be very unlikely to fail. I just last 3 days ago we implanted a patient that unfortunately the implant was extruded, was came off from the skin because the implant moved and it broke the skin and then got infected. That patient was implanted when he was 3 years old. Was implanted in 1996. I mean, he was implanted in December 2020, and he got his new implant just last week. So essentially, this patient were 26 years with his implant, no issues, and the implant was working until the day we took it out because essentially it was infected. We need to take it out. But what I'm saying is, don't be hesitant. I think that the technology is much better even than a pacemaker. Pacemaker need replacement more often because they have a battery inside. Cochlear implant doesn't have batteries inside. So that means that if the device is well and the device is functioning, it can last for life. So I don't think that will be anything of concern, especially with moms and dads considering their small kids to have a cochlear implant. Don't think that they're going to have a surgery when they're 20, because
Right.
might be they will need changes in their device when they're in their 30s or 40s, because it's something newer or something, we don't know what's going to happen in the future, but essentially this is a very long lasting technology.
Right. Right. Dr. Chizon, we have covered really good questions from our patients. These are the common questions. I would like to cover the adult cochlear implant. This is my last question from you. Would you like to say anything about the adult cochlear implants, the patients with good amount of hearing loss not responding to the hearing aids?
Yes, of course. Let me tell you this. This is a very funny story. Most of my professional life has been in Venezuela, which is in South America and Latin America, and I have been very involved in the cochlear implant programs in Latin America. And most of the cochlear implants, and probably in India, is the same thing. The majority of patients are kids. So my practice and my cochlear implant program, essentially, there were most of them were kids. Essentially, it's under 5 years old.
Mm.
When I came here to the U.S., I was very surprised that changed dramatically.
Right.
So now my patients are much older patients. Even patients. I have the opportunity to do a surgery about a year ago of a wonderful lady, 89 years old,
Okay.
and she was a perfect candidate for a cochlear implant. She's a very active lady. She
Okay.
plays cards 3 times a week, and she
Right.
was struggling with her life.
Mm.
And now she's very active, socially active, and we decided she's a great candidate. Got a cochlear implant, and every time she comes to clinic, she hugs me and said, listen, this is this is thanks I have this opportunity. This must last years of my life to get this. So the most important issue here about adults, and especially elderly, cochlear implants in elderly, because is how much of the hearing impairment and the cognitive, how well that brain is. Because remember,
Mm.
the organ who hear is not the ear, is the brain. The brain is the one who hears.
Right.
So if you have a patient, the patient needs to be sound in the sense of their capacities, their
Okay.
capacity to rehabilitate, the capacities to use the cochlear implant. So it's a big failure if you want to have these elderly person with have problems with memory. They have severe problems of memories. This patient is going to have tons of problems to rehabilitate, and it's not going to be a good candidate. So my recommendation is when you are dealing with an elderly patient, which is a good audiologically a good candidate for a cochlear implant, be very careful about their cognitive abilities, their memory abilities, their motor abilities,
Right.
their how their social life. That's very important because if you want to put something, it's something that is going to get the patient better. It's going to give you quality of life, not something that is going to add more problems to already a problematic, might be a problematic life.
Adult. Right.
That would be my recommendation. And it's a very big growing population because everybody's getting older because
Right.
everybody's living more. We're
Right.
living more. Life expectancy is getting extended and extended and extended, and the older we get, the more prone we're going to be in this situation where the cochlear implant is indicated in this population.
Right, right. With the gadgets being involved now, I think with coming next 10 years, we may be having more adults with more hearing loss until and unless they are not getting aware about the technology they are misusing for the hearing. Uh, Dr. Chiossone, it's a pleasure for me and for the people of my country and all over the world that you have taken the time from your busy schedule. Dr. Chiossone is not only into clinic, and he's not only a clinician, he's into research also, actively into research. He's extremely busy. It's his Sunday time and he is in scrubs. It's very rare to see in US, and it's a Sunday night for me. It's Sunday morning for him, and I'm really obliged. I really appreciate Dr. Chiossone. At this age, you are definitely example for me. It's really kind for you.
Thank you so much, Neetu. And as I always said, I was coming off camera. For me, um, India is in my bucket list. I will. I won't die before visit and going to India. You have a wonderful country, a wonderful people. All the people that I met, and I was lucky and blessed to train in the UK, where there's a big Indian community. And I have to say, I became number one fan of Indian food, which was not the English Indian food. I went to the place where my friends took me, which was their home, and always saw wonderful people. And I hope next time will be in India and share with you, your family, and your patients. Thank you so much.
Thank you, Dr. Chiossone. You're most welcome to our country. Thank you.
Thank you.